201. A client with pneumocystis carinii pneumonia is receiving methotrexate. The rationale for administering leucovorin calcium to a client receiving methotrexate is to A. Treat anemia. B. Create a synergistic effect. C. Increase the number of white blood cells. D. Reverse drug toxicity. 201. Answer D. Methotrexate is a folic acid antagonist. Leucovorin is the drug given for toxicity to this drug. It is not used to treat iron deficiency anemia, create a synergistic effects, or increase the number of circulating neutrophils. Therefore, answers A, B, and C are incorrect. 202. A client tells the nurse that she is allergic to eggs, dogs, rabbits, and chicken feathers. Which order should the nurse question? A. TB skin test. B. Rubella vaccine. C. ELISA test. D. Chest X-ray. 202. Answer B. The client who is allergic to dogs, eggs, rabbits, and chicken feathers is most likely allergic to the rubella vaccine. The client who is allergic to neomycin is also at risk. There is no danger to the client if he has an order for a TB skin test, ELISA test, or chest X-ray, thus, answers A, C, and D are incorrect. 203. The physician has prescribed ranitidine, Zantac, for a client with erosive gastritis. The nurse should administer the medication. A. 30 minutes before meals. B. With each meal. C. In a single dose at bedtime. D. 60 minutes after meals. 203. Answer B. Zantac, ranitidine, is a histamine blocker that should be given with meals for optimal effect, not before meals. However, Tagamet, cimetidine, is a histamine blocker that can be given in one dose at bedtime. Neither of these drugs should be given before or after meals, so answers A and D are incorrect. 204. A temporary colostomy is performed on the client with colon cancer. The nurse is aware that the proximal end of a double-barrel colostomy A. Is the opening on the client's left side. B. Is the opening on the distal end on the client's left side. C. Is the opening on the client's right side. D. Is the opening on the distal right side. 204. Answer C. The proximal end of the double-barrel colostomy is the end toward the small intestines. This end is on the client's right side. The distal end, as in answers A, B, and D, is on the client's left side. 205. While assessing the postpartal client, the nurse notes that the fundus is displaced to the right. Based on this finding, the nurse should A. Ask the client to void. B. Assess the blood pressure for hypotension. C. Administer oxytocin. D. Check for vaginal bleeding. 205. Answer A. If the nurse checks the fundus and finds it to be displaced to the right or left, this is an indication of a full bladder. This finding is not associated with hypotension or clots, as stated in answer B. Oxytoxic drugs, Pitocin, are drugs used to contract the uterus, so answer C is incorrect. It has nothing to do with displacement of the uterus. Answer D is incorrect, because displacement is associated with a full bladder, not vaginal bleeding. 206. The physician has ordered an MRI for a client with an orthopedic ailment. An MRI should not be done if the client has A. The need for oxygen therapy. B. A history of claustrophobia. C. A permanent pacemaker. D. Sensory deafness. 206. Answer C. Clients with an internal defibrillator or a pacemaker should not have an MRI because it can cause dysrhythmias in the client with a pacemaker. If the client has a need for oxygen, is claustrophobic, or is deaf, he can have an MRI, but provisions such as extension tubes for the oxygen, sedatives, or a signal system should be made to accommodate these problems. Therefore, answers A, B, and D are incorrect. 207. A 6-month-old client is placed on strict bed rest following a hernia repair. Which toy is best suited to the client? A. Colorful crib mobile. B. Handheld electronic games. C. Cars in a plastic container. D. 30-piece jigsaw puzzle. 207. Answer C. A 6-month-old is too old for the colorful mobile. He is too young to play with the electronic game or the 30-piece jigsaw puzzle. The best toy for this age is the cars in a plastic container, so answers A, B, and D are incorrect. 208. The nurse is preparing to discharge a client with a long history of polio. The nurse should tell the client that A. Taking a hot bath will decrease stiffness and spasticity. B. A schedule of strenuous exercise will improve muscle strength. C. Rest periods should be scheduled throughout the day. D. Visual disturbances can be corrected with prescription glasses. 208. Answer C. The client with polio has muscle weakness. Periods of rest throughout the day will conserve the client's energy. A hot bath can cause burns, however, a warm bath would be helpful, so answer A is incorrect. Strenuous exercises are not advisable, making answer B incorrect. Visual disturbances that are directly associated with polio cannot be corrected with glasses, therefore, answer D is incorrect. 209. A client on the postpartum unit has a proctoepisiotomy. The nurse should anticipate administering which medication? A. Dulcolax suppository. B. Docusate sodium, cholase. C. Methyrgonavine maleate, methergine. D. Bromocriptine sulfate, perladel. 209. Answer B. The client with a protoepisiotomy will need stool softeners such as docusate sodium. Suppositories are given only with an order from the doctor. Methergine is a drug used to contract the uterus, and perladel is an anti-Parkinsonian drug. Therefore, answers A, C, and D are incorrect. 210. A client with pancreatic cancer has an infusion of TPN, total parenteral nutrition. The doctor has ordered for sliding scale insulin. The most likely explanation for this order is A. Total parenteral nutrition leads to negative nitrogen balance and elevated glucose levels. B. Total parenteral nutrition cannot be managed with oral hypoglycemics. C. Total parenteral nutrition is a high glucose solution that often elevates the blood glucose levels. D. Total parenteral nutrition leads to further pancreatic disease. 210. Answer C. Total parenteral nutrition is a high glucose solution. This therapy often causes the glucose levels to be elevated. Because this is a common complication, insulin might be ordered. Answers A, B, and D are incorrect. TPN is used to treat negative nitrogen balance. It will not lead to negative nitrogen balance. Total parenteral nutrition can be managed with oral hypoglycemic drugs, but it is difficult to do so. Total parenteral nutrition will not lead to further pancreatic disease. 211. An adolescent prima gravida who is 10 weeks pregnant attends the antepartal clinic for a first checkup. To develop a teaching plan, the nurse should initially assess A. The client's knowledge of the signs of preterm labor. B. The client's feelings about the pregnancy. C. Whether the client was using a method of birth control. D. The client's thought about future children. 211. Answer B. The client who is 10 weeks pregnant should be assessed to determine how she feels about the pregnancy. It is too early to discuss preterm labor, too late to discuss whether she was using a method of birth control, and after the client delivers, a discussion of future children should be instituted. Thus, answers A, C, and D are incorrect. 212. An obstetric client is admitted with dehydration. Which fluid would be most appropriate for the client? A. 0.45 normal saline. B. Dextrose 1% in water. C. Lactated ringers. D. Dextrose 5% in 0.45 normal saline. 212. Answer A. The best fluid for correction of dehydration is normal saline because it is most like normal serum. Dextrose pulls fluid from the cell. Lactated ringers contains more electrolytes than the client's serum, and dextrose with normal saline will also alter the intracellular fluid. Therefore, answers B, C, and D are incorrect. 213. The physician has ordered a thyroid scan to confirm the diagnosis of a goiter. Before the procedure, the nurse should A. Assess the client for allergies. B. Bolus the client with fluid. C. Tell the client he will be asleep. D. Insert a urinary catheter. 213. Answer A. A thyroid scan uses a dye, so the client should be assessed for allergies to iodine. The client will not have a bolus of fluid, will not be asleep, and will not have a urinary catheter inserted, so answers B, C, and D are incorrect. 214. The physician has ordered an injection of Rogum for a client with blood type A negative. The nurse understands that Rogum is given to A. Provide immunity against Rh isoenzymes. B. Prevent the formation of Rh antibodies. C. Eliminate circulating Rh antibodies. D. Convert the Rh factor from negative to positive. 214. Answer B. Rogum is used to prevent formation of Rh antibodies. It does not provide immunity to Rh isoenzymes, eliminate circulating Rh antibodies, or convert the Rh factor from negative to positive. Thus, answers A, C, and D are incorrect. 215. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? A. Application of a short inclusive spica cast. B. Stabilization with a plaster of Paris cast. C. Surgery with Kirschner wire implantation. D. A gauze dressing only. 215. Answer B. A client with a fractured foot often has a short leg cast applied to stabilize the fracture. A spica cast is used to stabilize a fractured pelvis or vertebral fracture. Kirschner wires are used to stabilize small bones such as toes, and the client will most likely have a cast or immobilizer, so answers A, C, and D are incorrect. 216. A client with bladder cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to A. Strain his urine. B. Increase his fluid intake. C. Report urinary frequency. D. Avoid prolonged sitting. 216. Answer A. Iridium seeds can be expelled during urination, so the client should be taught to strain his urine and report to the doctor if any of the seeds are expelled. Increasing fluids, reporting urinary frequency, and avoiding prolonged sitting are not necessary, therefore, answers B, C, and D are incorrect. 217. Following a heart transplant, a client is started on medication to prevent organ rejection. Which category of medication prevents the formation of antibodies against the new organ? A. Antivirals. B. Antibiotics. C. Immunosuppressants. D. Analgesics. 217. Answer C. Immunosuppressants are used to prevent antibody formation. Antivirals, antibiotics, and analgesics are not used to prevent antibody production, so answers A, B, and D are incorrect. 218. The nurse is preparing a client for cataract surgery. The nurse is aware that the procedure will use A. Mydriatics to facilitate removal. B. Miotic medications such as Temoptic. C. A laser to smooth and reshape the lens. D. Silicone oil injections into the eyeball. 218. Answer A. Before cataract removal, the client will have mydriatic drops instilled to dilate the pupil. This will facilitate removal of the lens. Miotics constrict the pupil and are not used in cataract clients. A laser is not used to smooth and reshape the lens, the diseased lens is removed. Silicone oil is not injected in this client, thus, answers B, C, and D are incorrect. 219. A client with Alzheimer's disease is awaiting placement in a skilled nursing facility. Which long-term plans would be most therapeutic for the client? A. Placing mirrors in several locations in the home. B. Placing a picture of herself in her bedroom. C. Placing simple signs to indicate the location of the bedroom, bathroom, and so on. D. Alternating healthcare workers to prevent boredom. 219. Answer C. Placing simple signs that indicate the location of rooms where the client sleeps, eats, and bathes will help the client be more independent. Providing mirrors and pictures is not recommended with the client who has Alzheimer's disease because mirrors and pictures tend to cause agitation, and alternating healthcare workers confuses the client. Therefore, answers A, B, and D are incorrect. 220. A client with an abdominal cholecystectomy returns from surgery with a Jackson-Pratt drain. The chief purpose of the Jackson-Pratt drain is to A. Prevent the need for dressing changes. B. Reduce edema at the incision. C. Provide for wound drainage. D. Keep the common bile duct open. 220. Answer C. A Jackson-Pratt drain is a serum collection device commonly used in abdominal surgery. A Jackson-Pratt drain will not prevent the need for dressing changes, reduce edema of the incision, or keep the common bile duct open, so answers A, B, and D are incorrect. A T-tube is used to keep the common bile duct open.